obulamu buno bufaanana ng'eccupa eya gripu ku mulwadde etonnya ettondo limulimu bw'olaba erwawo kuba etonnya ttondo limulimu naye buli eritonnya teriddayo bw'ekyonebwamu ekyo tukigeraageranye ku bulamu buno tulabe wanowakeesa olunaku lumulumu lwelukyanga zikuweddeko ennaku zo tukeesa lumulumu terudda omuwendo gw'ebiseera bwe gutyo ozannyira mu budde bw'ofunye kiba kitalo nnyo ekyo tukigeraageranye ku bulamu buno tulabe wanowakeesa olunaku lumulumu lwelukyanga zikuweddeko ennaku zo tukeesa lumulumu terudda omuwendo gw'ebiseera bwe gutyo ozannyira mu budde bw'ofunye kiba kitalo nnyo obulamu buno buwenyuka ng'essasi olw'obutamanya ne tusooba ne tufa nga bingi tetubikoze kityo yagenda essira kumwa yafa apangisa iri ntinda abantu be yabaleka mu kazigo nga buli mwaka ajuliza buddako ekyo tukigera.
I'm really pleased to be here on this Namirembe Health Education talk. My name is Dr. Sabrina Chitaka. I am a pediatrician. I'm also a senior lecturer here at Makerere University. So, first of all, we need to describe what health is. And health is conformity of physical, emotional, psychological, and even nutritional health. When somebody feels healthy, they are happy, they are growing up normally. And I want to say that a child is anybody below the age of 18. And an adolescent specifically is somebody aged 10 to 19 years. Mental health is quite common. I am a pediatrician, but if I got a patient with a mental health problem, I would refer them to a psychiatrist. But we do know that mental health carries a myriad of events, including anxiety, depression, panic attacks, emotional distress, and even nutritional problems like anorexia nervosa, bulimia. There's so much. And I just want to say that here at the Friday Adolescent Clinic at Mulago, which we opened in 2013, we've seen more than 7,000 individual clients. The majority of adolescents don't come because they are mentally ill or they are sick. The majority are actually healthy. But the thing is, we have a particular interview, a mnemonic we use called the HEADS assessment, where we ask the adolescent about their home, their eating, exercise. We ask about drugs and depression. And honestly speaking, at one point in time, you will find that an adolescent is sad. And you should inquire a little bit more. Are they depressed? Are they losing sleep? Are they unhappy at home? And all those things can affect an adolescent. If the home is not well, if the parents are separating, if they don't have enough food to eat, all those things can cause some amount of stress. But just to summarize the common adolescent health problems, particularly mental health problems, there's anxiety. There's something we call conversion disorder, which lay people call hysteria. And for us, we think it's a disease. Like a child can be so stressed and then they start hyperventilating, or their arms become folded, or they get convulsions, but they are not real convulsions. They are called psychogenic. It's up to us as healthcare providers to identify what is causing this person so much stress. We've seen adolescents who are depressed. We've also seen adolescents who are suicidal. And we have to ask that question. Are you so sad you want to hurt yourself? We've seen adolescents with self-harm. They are cutting themselves up. They are running away from home. So they are delinquent. And so we would like to ensure that every single adolescent's problems are addressed. Drugs are becoming a more increasingly common problem. And drugs of abuse include alcohol, marijuana, hashish, all sorts of things. Some adolescents don't even know they are abusing drugs until you start to inquire, did anyone give you anything different that made you feel extremely happy? People are selling drugs to these adolescents using cookies and cakes, and it's frightening actually. Some adolescents we know are addicted to pornography, and some adolescents are also addicted to self-gratification, and they need to be supported. Mental health problems can only be diagnosed if somebody reports. Like if a family comes and says, our child is not happy anymore, they are keeping to themselves, they are talking to themselves. Our job is to take them through an interview, examine them, and then refer them to a psychiatrist who is in charge of doing the mental health care treatment. Adolescence is a challenging situation. It's a time of transitioning, it's a time of many, many changes, including physical changes, but also emotional changes. For the very first time in somebody's life, they are getting a huge surge of, let's say, estrogen and progesterone and testosterone, and it can be confusing to anybody. I want to ask you, when you were 11 or 12 or 13, what happened? Did you sometimes feel anxious, like, oh my God, my voice is changing? The boys get so confused when their voice starts to break, and then it's not breaking, and then they are growing beards, and the beards are not growing very quickly, and they are quite anxious. And some of the girls get bothered because their friends' breasts are becoming bigger, and then theirs are not, and then the hips are not coming, so there's some level of anxiety. And then the parents don't understand these adolescents. The parents are saying, why is my child quiet? Why is my child locking themselves in the room? And that can cause a lot of anxiety.
Akumanyo budde naye wane waffe n'ebitatugaza tugenda tulabe okukeerewa tukimanyi tukikola era twenyumiriza so nno we tutamanya biseera byegulumye we tutamanya biseera